I'd just like to welcome everyone to the Hawaii Care Choices Healthcare Talk Story. I'm Tish Lopez, your moderator this morning, and a huge mahalo to all our dedicated participants that join us every single month. We do see you. For those of you just joining in today, we are so glad you found us and are here. Happy beautiful Aloha Monday. Just a friendly reminder, today's talk story is being recorded so that you and others may access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. Hawaii Care Choices is now on Facebook, Instagram, and Twitter, so we'd love to ask you to follow us, see tons of contents, upcoming events, get to know our team, get reminders of Talk Story, and see the supportive community members and hear patient stories as well. For those of you joining us on Zoom, the bottom of your screen should look like this. Please click in the chat box to say aloha to everyone here and let us know where you're joining in from. In today's Healthcare Talk Story, we'll be diving in and talking about palliative and hospice care and how to plan ahead to avoid your home becoming a crime scene. You may ask questions throughout the presentation by clicking on the Q&A box at any time to submit your questions to our panelists. To those of you watching on Facebook Live, thank you so much for joining us and aloha. Please use the comment box to chat in and say aloha and let us know where you are joining in from. Feel free to chat in questions right there in the comment box and share your reactions throughout the entire talk story using your reaction buttons. We love to see the hearts, thumbs up, the care button, and feel free to share this live video to your friends as well. We are also doing polling today. For those of you watching on Facebook Live, you will not see the polls pop up, but we still want to hear from you using that comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month. Just email me at llopez@hawaiicarechoices.org and I will send you the link. So polling is very simple. A brain teaser bell will ring. A question will pop up on your screen similar to what you see here. Make the selection that you think is best and submit your poll using the bottom button. Just to kick things off, we want to go ahead and pull up an icebreaker right now. All right, so up on your screen is our icebreaker question. Would you rather climb a mountain, swim in the ocean, go on a road trip, or read a good book in your favorite spot? Again, no right or wrong questions. Feel free to click in the best answer and click submit. I see everyone is just popping in the answers right there, of course, coming through for our nice weekends. I wasn't able to do any of these, but I did get a nice clean house. So there it is. I'm going to go ahead and end the poll there and share our results. So 29% of you said swim in the ocean, 43% said go on a road trip, and 29% said read a good book in your favorite spot. Awesome. Well, that is it. Thank you so much for joining in on our icebreaker. Oh, and let me go ahead and stop the results here. Sorry, I am also our IT person here, so I apologize for anything out of the ordinary today. Oh, I would like to welcome our guest speakers joining us for the second time on Talk Story. We are so honored to have him. Please give a warm virtual welcome to Lieutenant Derr, Community Police Officer with the Hawai'i Police Department. Aloha and welcome, Lieutenant Derr. Lieutenant Derr, right before we start, could you please share with us what does the community policing do and how is it relevant to helping those who may have a loved one pass at home?
Sure. Well, community policing is a liaison between the police department and the community as a whole. And we generally will focus on systemic problems and issues that take a little longer to resolve. That type of thing. And we do a lot of outreach to the community, and I guess how it relates to hospice and what you guys are doing is we get to help spread the word about the police response to what happens when somebody passes away in hospice care versus when they pass away and they're not in hospice care. So we can kind of inform the community and the public And we do that not only for hospice, but a lot of other different issues. We'll do that as well with like public service announcements and that kind of thing. So we share a lot of information with the community.
Wonderful. Thank you so much for sharing that as well, and explaining that for everyone here today. Next, I'd like to introduce Lonnie Weigert, who is striving to raise the awareness about palliative, hospice, and bereavement care in hopes to provide a world-class healthcare and solutions for all. Give a warm virtual welcome for Lonnie Weigert. Aloha, Lonnie.
Aloha, everyone, and thank you so much, Lieutenant Derr, for joining us this morning. It's really quite an honor and privilege to have you here.
This morning, Lonnie and Lieutenant Derr will be talking about palliative care and the support you or your loved one may qualify for. Our guest, Lieutenant William Derr, will take us behind the scenes and share why your home could be a crime scene if your loved one dies at home. He has direct experience with assisting local families as well as his own surrounding the death of a loved one. So he will share his candid views on how people can avoid the unnecessary stress due to caring for a seriously ill loved one at home, simply by following a few steps. I am so excited for all of you to be here on Healthcare's Talk Story. All right, friends, here we go. I am handing over the virtual microphone to Lonnie so we can learn the reasons why palliative care can help.
Thank you so much, Tish. Let's just jump right into it. There's so much for us to unpack this morning. So what is palliative care? It's interesting to me how for many physicians, they don't really know what it is. And so for me to have this opportunity to raise the educational awareness to everybody that's on this call, I'm really, really happy to do so. So why is it that a lot of physicians aren't really aware of this type of care? And it's largely because pretty much in Hawaii, it's new, and that's why many physicians don't offer it. But after our presentation today, and after I tell you all the benefits of it, what you can do is definitely ask your physician for it if you think that's something that you could use. So palliative care is an extra layer of specialized care. So it's not routine care, meaning if you go to your doctor and they take your blood pressure and all of that. No, it's not. It's very, very specialized. And I'll explain to you exactly why that is. It goes well beyond routine care. And how it breaks down is the physician will focus on the disease. However, with palliative care, we focus on the relief of the patient, managing their symptoms and pain, the emotional stress, discomfort of treatments that normally happen when somebody is dealing with a serious illness such as cancer, and then they have treatments such as radiation or chemotherapy or even surgery. There's a lot of discomfort that comes with that. And so palliative care is really here to help improve the quality of life, not only for the patient, but for the family as well. Whenever there's a serious illness, for the most part, everybody in the family is going to be affected by that. And there's never been specialized care until now, and it's called palliative care. So when somebody is dealing with serious illness, palliative care comes in, and it's really about learning to live with the serious illness. And palliative care comes in and actually teaches people how to live at the highest level possible and still be dealing with their serious illness. So it's not end of life care. And that's where a lot of the doctors get confused as to whether or not they need to refer a patient. So I want all of you to know it's not end of life care. And you may actually need to help your doctor understand this. Patients can live for months, sometimes even years, and they just don't know that this wonderful type of care is available to you. The difference about this type of care is it really focuses on the patient's priorities, values, and wishes. We educate the patient and the family on what is to be expected about their serious illness. Can you imagine when somebody is, say, diagnosed with cancer? The immediate emotion is fear. But oftentimes, as the physician, and this is not taking anything away from them, they're going to be focusing on how to cure that that illness. And so they immediately start to say, oh, these are the different things, treatments you need to take, etc. But really at that moment, oftentimes people don't even hear whatever the doctor says. They are so impacted by their own fear. And even the caregiver who may also be in the room, they will, be elevated as well with regard to their anxiety and fear. And what does this mean? The beauty of palliative care is really about focusing on what is important to the patient. So say, for example, the physician who is focusing on curing the disease decides, okay, well, we'll schedule you for surgery, you'll go in here and you'll do this and that. But then it doesn't give the patient a chance to just air out what their concerns are, what their fears are, what their wants are. Really, whenever we decide to work with the patient and create their goals of care plan, it has nothing to do with medical treatment. It's really all about personally what their goals in life are. And so, for example, if somebody has, say, is diagnosed with cancer, and then their physician says, well, we'll go ahead and schedule you for surgery. But then what's so important to them is being able to bike ride every day, bike ride several miles a day. However, if they were to go into that surgery, they would never be able to bike ride again. This is why palliative care is so important, because without it, a lot of people will not know that the treatment may be misaligned with what their life goals are. And that's why this is definitely specialized care. A lot of people are not offered it because a lot of physicians do not know about it. And that's why it's so important that we're here this morning for me to share all of that with you.
Lieutenant Derr, over the years of being called to homes within the community, especially if someone is is seriously ill, in your opinion, would palliative care make a positive difference for the quality of life for the patient and their families?
Yeah, without a doubt it would, because like Lonnie had said, that the typical physician response is going to be focused on the physicalness of whatever that illness is, treating it, coming up with whatever it is, chemotherapy, whatever, but it doesn't address the other issue, which is equally as important in my opinion, and that's the psychological well-being of the patient, and honoring whatever their spiritual leanings may be, where palliative care addresses that, where it takes in count what the psychology of the person is, because a person's mind, frame of mind, is equally as important as their body, and the two interact. When somebody is in a good frame of mind, it transfers over to the body. So yeah, palliative care is very important, and I think it has a huge positive effect when that aspect is addressed, that person's psychology and their mental well-being, not just the physical aspect.
Thank you so much for sharing that. I completely agree.
Thank you, Lieutenant Derr. That's exactly why palliative care was created. It really is the human side of healthcare. It's where the emotional side, the psychosocial side of the care can come in, and it's not just the medical, focus. It's really the overall whole focus of the patient. Now, when people ask me what is a serious illness, so what you see on your screen here, these are some of the serious illnesses that we deal with. But in addition to this, besides kidney disease, also liver disease as well, cancer of any type, congestive heart failure, COPD, and sometimes people will live with these serious illnesses for years and will be living with suffering and discomfort for years as well, which then really takes a toll on their anxiety level as well as their depression. And here we go. Palliative care is here to help not only the patient, but the families as well. And it's really about trying to teach people how to deal with living with their serious illness, but also to minimize their suffering so that we can then level up their quality of life. And that's really the focus of palliative care. It focuses on bringing relief to the patient and the families, and also to help the families, particularly the caregivers, from having so much excessive strain on them with regard to taking care of their loved one. People are just not born to be caregivers. I mean, they need education, they need training, they need guidance, and that's something that palliative care comes in to provide for the family and the caregiving. And the other thing too is, just like Lieutenant Derr was saying, the emotional support can never be minimized. And that in our healthcare system, sadly, is something that is absent many times. There's nothing higher than palliative care and hospice care with regard to compassionate care. What does that actually mean? And it means to be able to address, hear, and listen and respond to the wishes and priorities of the patient and the family as well. And again, education is key, but that won't come unless palliative care is part of the solution.
Lieutenant Derr, why do you think people are hesitant to get this form of care earlier, before it becomes a crisis?
Well, I think because it's an eye opener to people. And like Lonnie had said, when you're diagnosed with something like cancer and stuff, the first emotion is fear. And I think a lot of people, they're hesitant because they have to face the reality that they have a serious illness. And that brings up a lot of unknowns in a person's mind of what that really means. And so I think people are hesitant because of that, because it's a difficult challenge to face the reality that, they have a serious illness. It can be, really scary.
Mm, Yes, I'm sure it definitely can be. Lonnie, I have a question for you as well before we move to the next slide. Um, let's see, Danielle from our listeners said, I am curious, what kind of dedicated staff do you have that attends to the spiritual and emotional aspects of someone struggling with a disease for patients and their families? And how are those staffs different than hospice staff?
Thank you so much, Danielle, for that question. So what happens is, within our palliative care team, our social worker will be addressing those types of concerns. It's really about having that conversation with the patient to really find out where their needs are. And if needed, then we'll have our spiritual counselor come in if they need that type of support. But for the most part, we have a dedicated social worker that comes in as part of our palliative care team to listen to the priorities, values, wishes of the patient, and then from there to create the goals of care that will align up with the type of treatments that the patient wants or doesn't want. And that's, I think, the part that's been so important about offering palliative care, is because before, a lot of patients would just get a battery of treatments, but whether or not they wanted it or they knew what to expect or not, none of that was part of the conversation. And now we make sure that that is the first part of the conversation, so that the treatments line up with what the patient priorities in their life is. And that part is so important to us. The other thing too is, we find that with regard to the goals of care, when we speak to patients about that, most of them will really tell us about their goals, which could be as simple as, I just want to be able to walk from my living room sofa to the mailbox because right now I'm so breathless I can't even do that. That could be one of the goals. But then there could be loftier goals, such as, I'd really like to join my family on the family reunion to Disney World next year. And then we start building backwards on, okay, what are the things that we'll need to do in order to achieve that goal? So it's really interesting when we speak to people about their goals of care, how none of it has anything really to do with the medical side of the care. But to bring both of them together is paramount, because without it, a lot of people could get unwanted and yet unneeded as well types of treatments that we want to avoid when we do this. And really, by providing palliative care, if you've ever gone to the emergency room with a serious illness, it is really horrors to be sitting in there waiting. And oftentimes we have to sit in there and wait for hours. So to be able to offer palliative care that you can get at home in your own environment that you're comfortable with amongst your family who can be there as well, there really isn't any comparison. And yet we continue to do these presentations every single month, but still thousands of people have no idea about palliative care. And because they're not offered it, they don't know all the benefits in which I'm sharing right now. So that's really our biggest goal, is trying to share that. Because when we looked at a lot of the statistics of people that were passing within the last 6 months of their life, they were passing at the hospital, number one, which wasn't necessary, because the reasons that they were passing is because their pain wasn't being managed. Okay, that's another thing for palliative care that can be managed at home. Their symptoms were not being managed either, like nausea, vomiting, breathlessness. All of that wasn't being managed at home either. And so they would come and stay sometimes for weeks at the hospital. Their healthcare expenses were going off the roof, when really all they needed was palliative care.
Thank you so much, Danielle, for sending in your questions and for Lonnie to answering them as well. Right, I think that new slide is up on the screen now. Sorry, Lonnie, are you able to see it?
Yes, there it is. Okay, sorry about that. All right, so on this one, I wanted to share the reasons why palliative care, and I've been sharing that pretty much since I got on here. But really, pain is more than just the physical pain. There's other kinds of pain that is happening. There's pain of isolation. There's spiritual pain, like, I'm dealing with this conflict with my kids, or my adult children are feuding amongst who's going to get the land, or whatever it is. There's many different types of pain other than physical pain. And with palliative care, we're able to come, get an awareness of what the patient is dealing with, and then educate as to what are different ways of dealing with that. And really, palliative care is about managing that pain. So it's not only physical pain, it's also very much the emotional stress and anxiety that happens not only to the patient, but to the caregiver and the family as well. And by having palliative care, there is education that is provided to teach the ways to cope and manage the pain and those symptoms at home, where a person as well as their family is the most comfortable. And so again, another reason why nobody should have to be suffering is simply to just ask your doctor for palliative care. And what happens too is, if the doctor doesn't know, the fact that you're asking will really heighten his or her awareness as to, I need to find out why they're asking me this. Or you know what, you could just call us directly. The dream is that one day everyone in the community will take responsibility for their own healthcare. And that will be the gift to us all, because then we won't have to worry that somebody is overlooked because they simply did not have access to this type of care. And when I say did not have access, it's simply because they did not know.
Definitely. And I know we've been talking a lot about emotional pain and psychological things that are happening. Lieutenant Derr, do you think that families discuss the emotions that everyone is dealing with, especially the patient and the caregiver, once the diagnosis is given, for example, like cancer?
Yeah, I mean, that's a hard question to answer, simply because everybody is different. Everybody has different communication styles. But I'm just really pleased to be here to discuss this because it's bringing up a lot of really good learning lessons and tools for people to use. Because with palliative care, it's a holistic approach. It's the mind and body and integrating them both. And one of the things that I think about is that just recently, actually last week, I was involved with someone who was in hospice, and they were at the hospital being treated, and when they could have been at home, which is going to be a much less stress on the family and stuff, because they could manage all those aspects at home, including the physical pain, because in this case, they were at the hospital. It's more of a sterile environment, not really conducive to somebody's psychological well-being. And they weren't being able to get the medication that they needed, the amount of medication, where at home, the caregiver could not only psychologically support this person, but also medically support that person by giving them the proper dosages of pain medication in this example, which is what makes palliative care a little bit different. And then to go back to, do I think families talk about this? Every family is different, but through webinars like this, it helps open up those communication between the caregiver, and people can reach out to community members that they know, like a neighbor or something like that. They're talking story, they hear that somebody was diagnosed, they can introduce the subject, they can help other families, even if they're not directly involved, communicate amongst each other so that the patient can express their feelings about what kind of care they want, as opposed to just being dictated, you're going to have this, this, and this. You can say, well, that's recommended, but this is what I want. And they can learn to express themselves and bridge that gap. So.
Absolutely. Thank you so much, Lieutenant Derr, for your opinion shared here today. I'm going to take it back over to Lani.
Thank you so much. So absolutely, what Lieutenant Derr was just saying is, rather than getting treatment just dictated to you, we can actually put the patient in the driver's seat. And that's what palliative care does. It puts the patient first, because we need and want to know what their priorities, values, and wishes are. So the goals of care plan really is about getting everybody on the same page, because sometimes, there could be family that's traveling to the home, from another island, or maybe from even the mainland, and doesn't really know what their loved one has been going through for several months, et cetera. And so we need to get everybody on the same page, because we have been with families who are going through debates on, no, we want mom to have this treatment. And then mom is like, no, I'm not about that treatment. I'd like to go natural. And then it just goes back and forth. So it's really important having the palliative care team there in the home to help the family navigate through the different choices that people will have. And then ultimately is to get the care that the patient needs and wants. And that's really the deciding factor or differentiator of palliative care, because without that, oftentimes people will get dictated all of their treatments, and whether they know that they can have them or not, it won't even matter, because by the time all of it is given to them, some people, which is really important, can't afford a lot of the things that they are being offered. And so that's another thing that palliative care takes into consideration. Working closely with the palliative care team, we're going in to make sure that this is the best that will fit the patient based on all of the resources that are available to the patient as well. And really, without palliative care, again, healthcare costs can skyrocket, largely because without the education of palliative care, people may be at home dealing with not being able to breathe, shortness of breath, or going through other type of symptoms, nausea, vomiting, etc. And then immediately will call 911. The ambulance will come, which is very expensive, take them up to the emergency room, which is very expensive. And then, after they are managed, they're sent home. When in fact, with the education of palliative care, many times the team is able to educate the family and the patient that this is a way that you can deal with any of that anxiety. And so, when that time comes where, dad can't breathe, okay, this is what my nurse told me that we should do. We should give him his medication. He needs to either inhale some of the oxygen or just drink water and relax. Let's wait a few minutes and see what happens. And then once that happens, where, wow, everything subsides, then the family starts to get confident again and realize, I think we got this. I think with their support and guidance to help us navigate through this, I think we could keep dad at home and we don't have to keep running up there and spending hundreds, if not thousands of dollars simply because we didn't know.
Wonderful. Thank you so much, Lottie, for sharing that. I did get a question about insurance and how it is paid for. So, Kristen, rest assured, we're going to get to that in just a few slides, but I wanted to share a wonderful flyer with you all. Lonnie, would you like to share a little bit more about this wonderful organization?
Yes. For those of you who are not on services with us, we would still very much like to promote the Advanced Healthcare Directive. And if you don't have one, it's the best, the absolute best gift that you could give your loved ones. It's free, and a wonderful organization called Community First does help us with this. In fact, they offer it for free to all of Hawaii Island. And what it is it's creating some instruction for any of your loved ones, should you be unable to speak for yourself. These written instructions will give a direction to your loved ones on what you would like with regard to, say, if you are unable to eat, or if you are on a ventilator, or what would you like them to do. And it's so great to have this direction for them, because it takes a huge weight off of their shoulders trying to figure out, well, no, mom would want to remain on this machine for as long as possible. And then maybe a brother will say, no, mom would never want that. She would always want to be living a very vibrant life, and this is not what mom would want. So this kind of conflict is quite common when people do not take the time to have an advanced healthcare directive created for them. So please take a look at this flyer here. There's information on it, especially the contact information on when their next presentations are happening, both in person and virtual. And we highly recommend for you to get an advanced healthcare directive if you do not already have one.
Yes, absolutely. It is a great tool. And to all of our listeners, I did put the link to register right in the chat box. So you can go ahead and click that and open up a new tab and save it for later as soon as we're done with this presentation. And that is our brain teaser bell. So I am going to put the question up on the screen. Early patient sign up ensures more support and quality of life for all. Again, for those of you watching on Facebook Live, you will not see the polls pop up, but we still want to hear from you. Feel free to put the answers right there in the comment box. Everyone is welcome to join in the fully engaged Zoom presentation next month by emailing me, lopez@hawaiicarechoices.org, and I will send you the link. Again, no right or wrong answers, just the answer that you think is best, and click the submit button below. All right, we just got a few more coming in. I'll give about a couple more seconds. Thank you to all of our listeners for using that chat box to chat in your questions. Feel free to chat in more as we go on. I'll go ahead and end the polling right there and share the results. 100% of you said yes, early patient sign up ensures more support and quality of life for all. That is absolutely true. Thank you so much for engaging in our polls, and I'm going to take it back to you, Ronnie.
Okay, thank you so much.
Oh, as soon as I can change the slide, I apologize. Thank you for everyone for following along with us on our talk story this morning.
Oh my goodness. So help for caregiver and family support. So this part is very, very important. And I've been sharing that largely from the foundation of education and awareness. A lot of families need the support. And remember now, caregivers are not born, they are trained and educated. So without somebody coming into the home and actually helping with that, it's very, very difficult. And this does not work though, unless there is early sign up, because early sign up brings early relief. And that's very, very important for the support of the family as well as the patient. And what we found too is that the suffering is actually very unnecessary, but oftentimes it continues largely because nobody knows about palliative care. And again, as soon as the healthcare industry starts to really catch up with it, we, meaning all of us on this webinar, will need to ask for it. If that's what we want for ourselves or for a loved one, we need to ask for it. And again, I'm hoping that by giving you all of this information, I am empowering you to ask for the help that you certainly deserve. And without this help, again, there's going to be a lot of emotional stress with dealing with a serious illness anyway, but the anxiety of it, continues to elevate. And then there could be quite a lot of conflict between patient, caregiver, and the rest of the family as well. So when we think about how much support we can provide as the need of the patient escalates, and it could be that a patient may need a higher level of care. We'll discuss that a bit more as we continue. But understand, palliative care is a very big umbrella. And of palliative care, there's a subset called hospice or comfort care that's involved in that too. And that, believe me, my friends, is the highest, absolute highest level of care there is.
I have a question for Lieutenant Derr. In your opinion, Lieutenant Derr, for those dealing with pain and discomfort from a serious illness, do you feel that they get the help they need early? Or if not, perhaps, why do you think that is?
Well, in my experience, I've had 4 direct experiences with hospice. And in all 4 of those, fortunately, they all did get the care that they needed, and it worked out wonderfully. But I think it's a little bit unique because the fact that I was involved and I'm a policeman, I knew in advance how things worked. So I was able to lend some advice to those families and whatnot so that they got that care. So they didn't end up in the police response model that if they're not enrolled in hospice or palliative care that we have to go to, because the police response is a very different response than what hospice does. And if you don't mind, I can give you just a brief explanation of the difference. If somebody's going to pass away and they can get into the hospice or palliative care within 24 hours before they pass away, then the police response is basically none. We don't have to show up at the house. All that's required is a phone call from the health provider, the caregiver. We take a little bit of information down over the phone and it's done. Then the family has the they don't have to worry about policemen showing up, making a diagram of the scene, because if they're not enrolled within 24 hours, we have to show up, we have to do a diagram, we have to take photos of the departed, we have to physically handle the departed by rolling them over and that kind of thing, checking the body, where we know that, you know, for example, I'll just give this example, you know, grandma, who is 99 years old, was expected to pass away, but if they weren't in that situation where they had been enrolled, police have to go, we have to interrupt the family, disturb them, and there's nothing worse I could imagine of having, you know, 3 or 4 policemen in your home who are complete strangers when, you know, grandma had just passed away and they're asking a million questions, they're going through all the medications, collecting all that, you know, saying, can I take a picture? And then they're watching the policeman roll, you know, grandma all around, and that kind of thing. So that's a huge difference. And that's typically, you know, we're mandated to do that. I mean, it's not like we have a choice, you know, that's the police response when somebody passes away and they weren't enrolled in hospice, where we don't even have to show up. The family can stay with the loved one. Because here's a couple of situations that people get a little bit upset, is when the person passes away and they're not in hospice, even though rightfully they qualify and really should have been. Not only do we have to go through that situation, but then the decedent has to go to the hospital, to the morgue. And 9 times out of 10, a partial autopsy has been ordered. Then we have to find the person's principal care provider. And sometimes that's easier said than done, right? Because then the doctor will have to say, okay, no autopsy, all this kind of stuff. So it just eliminates a lot of stress on the family. It keeps the police resources free to deal with other things that rightfully aren't really, you know, we should be dealing with, right? Because we know that this person was expected to pass away. So those are the kind of advantages of getting the palliative care early, getting enrolled in hospice when somebody's expected, you know, that they're going to pass away, that they have some kind of terminal disease. Because again, we're talking about the holistic approach, and the stress on the family is going to be huge. And this will eliminate so much of the stress when you don't have to have the police show up at the house and that kind of thing. And it allows the family a lot more leeway, because one other thing that comes up often is when the person who passed away is taken to the hospital, the family can't be with that person. They can't go to the hospital and pay their last respects, right? The emergency room in the morgue, they don't allow that, right? So depending on when we, the police, can get a hold of the doctor and then the body can be released, it could be days before the family can be with that person. And that creates a lot of stress. Whereas if they were enrolled into hospice or whatever, they can go right to the home, be right at that person's side. They can be right there to say their goodbyes, and then they can make the arrangements to have that person taken from the home to whatever mortuary they have chosen. So that's another issue that happens that I see a lot, because we get a lot of people who will call and saying, I want to see grandma, right? And we'll be like, oh, we're sorry, we can't help you because the hospital has certain rules, right? And they can't allow family members to come in and visit and pay their last respects. And so that avoids that whole scenario as well. And, you know, that comes up, you know, too many times in my opinion. And so that's another reason to get involved with hospice, get somebody who's been diagnosed with a terminal illness to get involved early because, you know, I guess one of the things I'm trying to say too to families is don't give up hope. Just because you get somebody enrolled in hospice doesn't mean they're going to pass away tomorrow. They could be alive for years after. You just never know, right? And hopefully with that type of care, palliative care, a holistic approach, they will stay better for longer. But don't give up hope, and don't do it just because you feel like, oh, well, it's giving up then, because it's not. It's just approaching the subject in a bigger picture way. So that's my suggestion. And I'm glad you showed that advanced healthcare directive link, because I'm going October 6th. I think it was Thursday, October 6th, because you don't want to miss that, because you got to do it while you can do it. You know, it's a little too late once you can't talk, once you can't eat, once you can't, whatever it is. So please take advantage and click the link and check it out. I'm going to.
Thank you so much, Lieutenant Derr, for sharing all of that with us. I know we actually have a patient story about the Advanced Healthcare Directive. Everyone can watch it on our website, hawaiicarechoices.org. So thank you. It's such a useful tool. I know we're talking about, or a lot about, palliative care and switch to little hospice care. So I'm going to go ahead and switch the slide, and so that Lonnie can explain a little bit more on the smooth transition to a higher level of care.
Thank you, Tish. Thank you, Lieutenant Derr. That was really great for you to fill in all of the details of that, because a lot of people really didn't understand when we said, you know, your home could become a crime scene, and people were just asking, like, what are you talking about? But yeah, if they're not enrolled in a program like ours, they would actually be subjected to that level of scrutiny, because that's the law. So thank you so much. And also, thank you very much for mentioning about the Advanced Healthcare Directive. It is amazing how many people, maybe even on this webinar, that still have yet to get theirs done. But, you know, it is the best possible gift to give a loved one, and it is free. So the ladies at Community First are absolutely amazing. So please let them know, Lieutenant Derr, that we said hi when you head out their way as well. And you allowed us to segue just so smoothly into when somebody needs a higher level of care, which is the highest, and that is hospice care. So I have been speaking about palliative care, and our program is called Kupu Care, Kupu, Kupu Care. And that is, Kupu means to sprout the different types of services that anybody will need. And Kupu Care is for those who are living with a serious illness. For hospice care, it's for those living with an advanced illness, meaning an illness that is terminal, and they decide that they do not want to take any kind of treatments at this point. They just want to focus on comfort. They just want to enjoy the time with their family and friends near. And really, it's exactly what Lieutenant Derr said. It isn't about giving up hope. If anything, it's really about redefining hope on what is important to the patient at that time. And it may be, you know, they just want to go for car rides down to the beach because they used to be an avid fisherman, or they just want to go for a ride around the island because they remember how it used to be when they were in Waimea, or whatever the situation is. We allow people to celebrate to their very last breath, and it is constantly and primarily, most importantly, about living. So we are able to allow people to do that and help and support the family and caregiver at that time. In order, like I said, you know, caregivers are not just born, they definitely are trained. Caregivers need a break. And when they are part of our program, we're able to support them in many ways, particularly respite care, which is where we come in and have the patient go to our long-term or our facility, our patient care facility, Hawai'i Malama, where we can care for them for up to 5 days while the caregiver gets some rest, some much needed rest. This kind of respite care is really important, particularly when our trained volunteers come into the home and allow the caregiver to go out and do whatever it is that they want to do, or maybe just sleep for a couple of hours or go out and clean the yard, whatever it is to help re-energize the caregiver is why we are part of that team. And that can never be underestimated or discounted in any way, because a caregiver is a very, very hard job. And oftentimes we will see, without any support, that a caregiver will start to become more frail than the patient themselves. And so it's important for us to get in there early and help a patient. And again, just like Lieutenant Derr was saying, it's not about giving up hope. It's really about redefining it. And how people receive hospice care is their doctors will give the best guesstimate of a 6-month life expectancy. And what we have found is many times when we come into the home and we're providing this intentional, compassionate care, that the patient gets better. We have many times where patients graduate off our services and then may continue to go on and just be living life. And then they come back to us when they need our care again. And then we help boost their quality of life again. And so just like Lieutenant Derr said, you know, people could live for years. And we have had, we just recently had a patient who was 104 years old. And once he came on our services, his health just improved to a degree that he made his 105th birthday as well. And it started to astound the family so much that they started to ask, do you think Grandpa's going to outlive the Hawai'i Care Choices team? Anyway, that was just a beautiful sentiment on how things can really improve when compassionate care comes into somebody's life. And so it really makes a lot of sense when somebody is on palliative care, kupu care, and then there's this a beautiful, smooth transition into hospice care when that time comes and they need the absolute highest level of care. We will already be there, ready to hug them with all of those services as well.
All right, and there is our brain teaser bell right up on the screen. I should be seeing, or you should be seeing, a question. All right, there it is. How is palliative care and hospice care the same? Both relieve suffering, both can be delivered in patients' homes, both improves the quality of life for patients and their families, both improves, there are both improves in quality of life for patients and their families on there twice. I apologize, or all of the above. Again, no right or wrong answer, any answer that you feel is best, and click the submit button below. For those of you watching on Facebook Live, you will not be able to see the polls, but we do want to hear from you. Feel free to put your answer right there in the comment box. Again, everyone is welcome to the Fully Engaged Zoom presentation. Just email me and I will definitely send you the link. All right, we're going to go ahead and end the poll right there and share the results. 100% of everyone said yes, all of the above. I will stop right there. Thank you so much for engaging in our polls. And back to you, Lonnie.
Okay, thank you. Tish, did we get a question that came in for Lieutenant Derr?
Oh, yes, we did. I apologize.
Yeah, I can answer that. I saw that. It's a great question. And it's if a patient is not on hospice and their doctor knows and can tell the police they've been diagnosed with the life-ending disease, is there still the Morgan autopsy requirements? Yes, there is. The only way we can waive that if they haven't been enrolled in hospice and stuff is if we can contact that doctor and the doctor is willing to sign a piece of paper waiving that stuff. The problem where the problem lies is sometimes we cannot get a hold of the doctor during that event because maybe it happened at Friday at 4:30 in the afternoon. We can't get a hold of the doctor, or maybe the doctor went on vacation. And it has to be a doctor who's willing to sign that paper saying we're waiving the autopsy morgue requirements. And a lot of doctors don't want to do that for somebody who's not their patient, right? So we may go to an alternative doctor. Hey, doctor, can you please sign this? Because, you know, it really, we don't need to do this, but they're not willing to. And then, you know, the primary physician, they're like, sure, I would sign off on it, but maybe we can't get a hold of them. Maybe it's on the weekend or they're on vacation, which means that person who passed away has to go to the hospital, has to be placed in the morgue until we can get the doctor to sign off on that. So that's why it's important that, yes, it can be done, but that's the little glitch that why it's important to get people enrolled if, you know, if there is a terminal diagnosis for that person. So it's a great question.
Thank you so much for answering that, Dr. Lieutenant Derr. Back to Lani.
So with regard to how palliative care or kupu care is paid for, it's like coming to a specialty doctor, such as an oncologist or a cardiologist, etc. It would be a similar copay to that if somebody was covered with just Medicare or just HMSA or just whatever. Sometimes patients will have Medicare and Medicaid, and that's what actually this other one is supposed to be. If they have double coverage, there is no charge at all for any of the services for palliative care. However, on hospice care, if a person is receiving hospice care at home, it is 100% covered by Medicare or any of the insurance companies because they all have a hospice benefit. So it's really amazing to get all of this, and really for a very minimal amount of money, especially for how much or how robust the services are for hospice, and get it all included is really quite amazing. What's happening right now is Medicaid is looking to see if they can include a bundle package for palliative care because they see how much savings, what a win-win-win it is for the patient, the doctor, the insurance companies, when palliative care is inserted into healthcare, and they want to do that across the board for anybody that has Medicaid. So that is something that is coming down the pike right now for Hawaii. And once that is, then we'll really be screaming it off the top of the hilltops to let people know you can get it, you can get it, and it is going to be included at that point. And I'm sure that Medicare will follow suit with that as well. So again, on palliative care, there could be a copay if, depending on what the insurance is. For hospice care at home is 100% covered. And if somebody needs to go to a long-term care facility or even to our patient care facility, what would happen is if they have Medicaid, they would not have to pay for the room and board. And sometimes other insurance companies will come in at that point, Akamai Advantage from HMSA, etc. So it really depends on what a person has, but minimally, it'll just cost a copay if somebody only has one type of insurance. And so this last slide is really important to know how to contact us. So go ahead and take any information from here. But my bottom line to everybody, after just, you know, giving you a battery of all of this information, is please ask if you think that palliative care will help you or a loved one. Please ask your doctor for it, or call us directly and we'll ask for you. But this is the biggest crime that has happened year after year, is that it's offered, it's provided, and still people don't sign up for it. So I'm just letting you know that you can take the entire responsibility of your great healthcare under your own control and decide if something like this would be good for you or your loved one. So again, ask for palliative care. Thank you, Tish.
Thank you so much, Lonnie, for your explanation of palliative care and how it can help. Thank you so much to our audience for listening this morning on this healthcare talk story. Very special mahalo to Lonnie Weigert and Lieutenant Derr for your valued time and such helpful perspectives that were shared today. A little heavier subjects than we usually do, but so needed and able to talk through. If you have specific questions about you or your loved one's situation, please, like Lonnie said, reach out to us. We have such a helpful team standing by that will be happy to answer all of your questions by calling us at 969-1733. You can also email us at care@hawai'icarechoices.org or ask your doctor if palliative care is right for you. Again, as Lonnie said, our hope is that you receive the right care at the right time. For those, I forgot I had a bell on that one. For those of you joining us on Zoom, there'll be a quick survey that pops up on your screen. Please make the selection that you think is best for all 6 questions and then click the submit button below. It is anonymous and will not be shared. We would just love to get your feedback on presentations like these. Your input will allow us to gain a better understanding of how we can support and serve our community with presentations like these in the future. For those of you on Facebook, please send your thumbs up and hearts if you enjoyed this presentation, and also say mahalo to our guest speakers. All right, those questions for our Zoom guests should be up on your screen now. I think everyone can see. All right, wonderful. It's all there. All of you are invited to join in next month's fully engaged Zoom presentation next month. Again, just by emailing me, lopez@hawai'icarechoices.org, or you can sign up on our Facebook page as we do go live every month. Again, mahalo, Lieutenant Derr, for just giving us so much information, such valuable insights from your own experiences. We are just so honored to have you and taking their time out of your busy schedule. Is there any last comments that you would like to share with everyone while they do their surveys?
Yeah, thank you. I just want to say thank you to Hawai'i Care Choices for everything that you do. You guys are amazing. You guys are just amazing, and thank you so much.
Thank you so much. Is there a final takeaway that you would like to share with us for today's talk story?
Yeah, just get involved, get your loved ones, spread the word to your neighbors, other people, because there's a lot of resources out there, and just spread the word, because it's well worth it, because it's a holistic approach that's it's a win-win situation.
Yes, I definitely agree. Lonnie, are there any last comments that you'd like to share with our listeners?
Oh, I just commend Lieutenant Derr. He just got it down. It is just so beautiful to have him come and share this aspect, which most people have no idea about when it comes to what happens on the law enforcement side. And I'm really glad that he is part of our team with regard to supporting our community. So thank you again, Lieutenant Derr. And I ditto everything that he just said.
I definitely agree. And listeners, for me, if you feel like you've benefited from this presentation, please let your friends and family know that they are welcome to join us on every month, the 10th at 10, or if the 10th lands on a weekend like it did in September, we will get back to you on the Monday. So happy Aloha Monday, everyone. If you want to join us next month, October 10th, please visit our Facebook, Instagram, or our Twitter to register, or you can go on www.hawai'icarechoices.org/healthcare talk story. Mahalo again for everyone that has joined us today, and I wish you a beautiful Aloha Monday. Aloha.